let's talk about this crazy, bizarre, opportunistic fungal infection called valley fever. And I'm just going to start out with some general information because there's probably a lot of people that don't know about it and they need to know about it because valley fever is spreading. It started in the southwest United States and it's spreading north and east throughout our country. So it behooves us to understand what valley fever is and what it does so that we can recognize it. So, valley fever is called coccidioides or coccidioidomycosis, and it's an opportunistic fungal infection that um, that is endemic to the Southwest United States. It started in California and Arizona, and it has spread to New Mexico, Texas, Utah, um, Nevada, and then north to Oregon and Washington. So it's also in Mexico and South America. And because of global warming and climate change and things like that, other places are becoming more suitable to the fungal infection to this fungus, so it's able to grow in more places, and um, it can spread through the air. So let me explain the organism itself. So it's a fungus, and basically, valley fever lives kind of like a mold or kind of like a mushroom in the soil. So it lives in the surface of sandy soils and it it grows as little mycelium or little filaments in the soil. And it just kind of hangs out there. And when it rains, those filaments grow like crazy. They spread like crazy throughout the surface of the soil. Yeah. And then when it dries out, when the weather dries, those the filaments have spores or arthroconidia, and those arthroconidia break off because they get dried out. They break off and they become airborne, and so just walking through an area can kick those spores up. Um, Dust storms really make them get kicked up. Construction, earthquakes, um, fires, any kind of thing that disrupts the soil will make those spores get kicked up into the air and they can literally float for miles. And that's how they spread to these other states. There are other ways that they think they spread, like through rodents and stuff. But they're still kind of researching that, I think. Um, but the spores or the arthroconidia are microscopic. You can't see them. And there's no way of knowing if they're where you are. Like they have done research or they're still doing research and they're putting filters up around the state and trying to figure out the hot spots where the fungus lives and it's just kind of random. It hasn't I don't think their research has proven, what areas what kind of areas are most likely to have the fungus, but they have figured out what areas are the hot spots, like in the Phoenix metro area, there are hot spots. But that doesn't mean you're going to get valley fever. So any mammal can get valley fever, and we see it most commonly in people and dogs. Cats can also get it, horses, farm animals, any mammal can get it. But by and far, dogs and people are the most commonly affected by valley fever. And you can't avoid it because it's in the air and you don't know. So there aren't really any PPE um, or personal protective equipment. I mean, people talk about wearing masks, but you could wear a mask all the time, and I don't know. I think there are pros and cons with that. But my feeling is if we support our immune system and if we support our pet's immune system and make it as strong as possible, that's how we prevent getting an infection such as valley fever or really any infection. So, the way that you get an infection with valley fever, whether you're a person or it's your dog or even your cat, is these spores in the air are breathed in. And with a normal, healthy immune system, your immune system will kick in, or your dog's immune system will kick in and kick those spores out and contain the infection, and you won't have any symptoms at all. So that's ideally what happens, and that happens with most people and pets. They're exposed to the valley fever spores, and their immune system is good, takes care of those spores that get into their lungs. That's the end of the story. But that's about 70% of the cases. 30% of the cases, a dog or a person will breathe in the spores and their immune system doesn't contain it, and it grows in the lungs. And it's a really bizarre fungus because it morphs. So it starts as a spore or a mold kind of thing, and then when it gets in the lungs, it turns into a yeast-like organism, and it's called a spheruole. So it grows, it changes into a spheruole, filled with endospores, and these spherules are just these round um, spheres, and they're packed with these endospores, and they multiply within that spherule, and then the endospores just get so dense in the spherule that the spherule breaks open and spews all the endospores into the lungs, and those endospores then grow into more spherules, and then that's the cycle in the lungs. And clinically, or like your symptoms, it starts as a infection in your lungs or a pneumonia. And it's very painful. It's extremely painful. I've had it twice. And it's something that once you've had it, you will never forget because it's so painful. And that's one thing that I stress when dogs or even cats get valley fever, or any animal, anyone that gets valley fever, you have to manage the pain component because this is an extremely painful condition. That's a side note. Okay, but it starts as a a pneumonia. And ideally, um, the immune system can still kick in and take care of it. Um, but a lot of times the person or the dog needs help. And so normally we'll start antifungal pharmaceuticals like fluconazole is usually the first thing that's prescribed for both people and animals is fluconazole. And that helps slow down that fungus and allows the immune system to then be able to take care of the rest of the infection because most drugs for valley fever will not kill the fungus, they'll just slow it down. So that's another ideal situation where you get a pneumonia and then it gets cleared with the help of pharmaceuticals and maybe other things you're doing, lifestyle changes, diet and supplements and that kind of thing. So that's another story for a different video. But if your body does not take care of that pneumonia, or if the pneumonia gets taken care of and it goes deeper in your body, it can actually become a chronic low grade infection in your body and you don't know it. So you get over the pneumonia and you think everything's fine and it's still in your body. So that happens in about 6% of people and dogs where they get over the pneumonia and then it stays in the body and it can go other places. And that's called dissemination. But before we go over that, Let's talk about the symptoms of valley fever when we have the pneumonia component. So, usually, people or pets will have a cough, a fever, they'll be lethargic or fatigued, they won't have a good appetite, they'll be uneasy because they're painful. It's very, very uncomfortable. They won't want to, like dogs won't want to go for walks. They just want to lay around and sleep. They may have swollen lymph nodes, and same with people. This all goes for people also. So it's kind of like these flu-like symptoms, and that's one reason that valley fever gets missed and it gets misdiagnosed because we've got these really general flu-like symptoms to start, and a lot of vets think it's kennel cough because it looks just like kennel cough. And if it's mild, it can look like allergies. So it gets misdiagnosed or just missed. And even in endemic areas like the Southwest United States, it still gets missed. And in other areas where it's not as common, it gets missed a lot because vets and physicians don't have it on their radar, so they're not looking for a fungal infection. I actually had a case from France that had typical fungal pneumonia, symptoms, and they never tested for their fungal diseases. It just gets, um, missed for some reason. They don't even put it on their differential diagnosis list. All right. So we've got flu-like symptoms to start, and hopefully things go well. You or the dog clears it, and we're all good. Well, that would be great. But then we have a small percentage of patients or people or dogs, um, where it's smoldering inside the body, and this may show up as um, problems anywhere in the body. So it can go to the joints and cause joint pain, which can show up in a dog like lameness or limping, or you may notice a joint swollen, or maybe back pain or neck pain when the joints of the spine are affected. Um, they can have muscle pain, they can have weakness, they can have bone swelling because it can get into the bones and the joints. And let me tell you, that is also extremely excruciatingly painful because my valley fever went from my lungs and I thought everything was fine. And then it showed up in my knee. And that was horrendous. So in people, it likes to spread to knees and ankles. In dogs, what I find is it really likes to spread to hips. And so that gets misdiagnosed as hip dysplasia or arthritis. So you have to, if things don't seem right, um, you have to advocate for yourself or advocate for your dog. And if you know about what this is and what it can do, you're more likely to advocate for yourself, get proper testing, get proper treatment so that you can get over it and it doesn't get worse and worse and worse and worse because it can be fatal. It's a serious thing. So, other things that can happen is it can stay in the lungs and cause granulomas or fluid in the lungs. And then you would have your dog, for example, would have shortness of breath, difficulty breathing, unusual panting when they're not in if it's not hot out, and then a chronic low grade cough. So it can stay in the lungs and cause other more severe problems in the lungs. That's the other thing it will cause. Same with people. People even have a more severe problem in the lungs where the lungs actually just melt. Like it just destroys the lung tissue. We don't see that so much in dogs. We see mostly the granulomas and then the fluid in the lungs. But it's severe. I mean, those um, types of valley fever where it's disseminated are life threatening. Other places that it can go are the brain and the spinal cord. So the central nervous system. So if it goes to the spinal cord, it can cause paralysis. So a dog will get weak in the rear end or paralyzed in the rear end, and that gets misdiagnosed as IVDD or a slip disc. Or if they have meningitis, which will look like neck pain, they get misdiagnosed with a disc problem in the neck. And I actually, one of my patients, I actually thought that's what it was, and it ended up being valley fever. So it's really tricky to figure out, because it mimics all these other things. And then if it gets into the brain, um, seizures can occur. So when your dog develops seizures, valley fever needs to be on the list of possibilities to test for. If the situation in the brain gets worse, it can cause inflammation of the brain, or encephalitis, which will cause your dog to be out of it. There's like nothing there. That's what happened to my dog, Katie. It went from her lungs to her bone to her spine and then to her brain so quickly that it was insane. And that's why I talk about it because people need to know what to look for and they need to know that they can test for this and treat it before it gets to that point. Although valley fever is very unpredictable. So even if you do all the right things, bad things can happen. So we just need to really stack the deck and make sure we're doing all the right things and everything we can so it doesn't happen, but sometimes it does. It's just there's just so many variables with immune systems. All right. So valley fever can also go to the skin. And that's a situation that gets missed too because it'll look like an abscess, it'll look like just a wound, it'll look like a rash on the skin. Um, we can have just oozing sores that heal and then break open again. And I had one case where, the dog had a ulcerated mass that went away with valley fever treatment because we diagnosed valley fever because of the bone lesion, but the ulcerated mass went away too, which means that mass was also valley fever. And I actually had someone contact me about mast cell tumors that were never tested. They were never biopsied to confirm it. And they sent me a picture. And I'm like, dang, those look like valley fever lesions. And the dog had had valley fever in the past and had only been treated for 3 months, which is not enough time. So likely those lesions had been misdiagnosed as mast cell tumors and were really valley fever, and they were treating the wrong problem. Um, The valley fever can go to the eyes, and this is something that gets missed because the dog may have just red, goopy, sore eyes, and it looks like allergies, or they have cloudy eyes. Um, some dogs will all of a sudden have vision loss or reduced vision, and I actually saw this. Someone had contacted me and gave me all these symptoms the dog had, and the dog had had valley fever in the past, and they said all of a sudden the dog just doesn't seem like it can see. And I was like, you need to go retest that valley fever and see if it's spread because that's another symptom. So, swollen eyes or even bulging eyes because it can cause inflammation inside the eyes. Other things that we see, it can go to the heart. And when it goes to the heart, a lot of times the symptoms are so mild where they have kind of a funny cough, like a throat clearing cough, and exercise intolerance, and they can have fainting, but we usually don't get to that point. What usually happens is we get valley fever in the heart. It'll cause a myocarditis. It can lead to a myocarditis is inflammation of the heart muscle, and it can lead to pericarditis or pericardial effusion, where they develop fluid within the pericardial sac around the heart. and it squeezes that heart so it can't pump and causes heart failure and acute death. So some of these guys that have valley fever and they're fine one day and they're dead the next, it's usually because it's gone to the heart. My dog Griffin, that's actually probably what happened to him. He was being treated for valley fever, doing great, and then all of a sudden he died in his sleep. And he was under treatment, doing all the right things, and he passed away in his sleep. And likely it was because it went to the heart. Interesting side note is I have another patient that I did a consult with who ended up at the ER with a tachyarrhythmia, meaning a extremely fast heart rate that was, um, and the rhythm was off, and they could not get this dog under control with IV drugs, IV fluids, IV heart medications, um, and drugs to reduce blood pressure, like, they could not get it under control, and they told the pet parent that the dog would be dead within 10 days or something like that, and she's like, "I'm just gonna take him home," and she called me for a consult, and I'm like, "I think that's valley fever," because the dog had been treated for valley fever in the past, and now it had this myocarditis, inflammation of the heart causing this heart rate of like 300, and the heart rhythm was all over the place, and the dog was just a mess. It was pale, and lethargic, and just having these weird symptoms. And so we we switched gears and treated more aggressively with pharmaceuticals and herbs and supplements for valley fever. And I put a plan together, and the dog survived, and the dog is doing great. So even if it goes to the heart, if we can catch it in these early stages, there's a possibility of helping these guys. Other things or other places valley fever can go to are, if you've got an intact male dog, loves to go to testicles. So you get these swollen testicles, and the conventional way to treat it is just to neuter them. So that's another discussion. But commonly when valley fever goes to places that can be removed, like testicles or toes, we usually remove that part of the body. Unless it's mild and we can get started on treatment and help it that way. It also goes to the liver, the kidneys, and it will look just like liver failure or hepatitis. It'll look like kidney failure or glomerulonephritis when it's really a fungal infection in that organ. So valley fever literally can go anywhere. It goes anywhere it wants. And it shows up differently in every person and animal. You never know where it's gonna be next. It may be that whatever your weak spot is, maybe that's where it goes. Who knows? But it's a severe fungal infection that can start as this mild respiratory infection that can lead to a pneumonia and can spread to anywhere in the body. So that's valley fever in a nutshell. All right. So I have information on valley fever. Let me put up a QR code for you. This is a free guide. Let's change how I do this. Let's see. QR code. So this QR code, you can scan it, and let's put it over there. There we go. You can scan the QR code, and this is a free guide, and it has a symptom checklist in there, and it has more information on valley fever, so you can check that out. Let's see. And then what else do I want to tell you? So, treating valley fever is challenging because you have to not only treat the fungus with pharmaceuticals, ideally, it's a serious thing. So, I really do all I can to help treat the problem. integratively with both pharmaceuticals and natural strategies like herbs and supplements and diet therapy. And so, if you think your dog might have valley fever or they do have valley fever, and maybe you're just beginning on the journey and you want to know if you have more options, or maybe you've been on the valley fever journey for a long time and your dog is still positive and the titers are plateaued and you just can't get them to go down, which is very common when you just do pharmaceuticals. So I actually have a online DIY program called Rescue Your Dog from Valley Fever that walks you through the conventional treatment and then the natural treatments that you can use to augment the conventional treatment, and all the strategies I use to get dogs to a negative titer and get them cleared of valley fever. So there's a QR code for that program. If you um, don't want to delve into the whole program yet, you can actually get my book on valley fever, the Conquering Valley Fever book. And let's see, let me find that. It's less of a um it's a lower cost way to find out more about valley fever. And my Conquering Valley Fever book, you can actually get the instant download of the book and a healing toolkit for 9.99. And I basically go over valley fever and then all the things I do to help dogs get better. And it has a comprehensive um, uh, guide or comprehensive list of resources in the back of all the herbs that are used for fungal infections. So this is a an easy read, and it helps you know what to expect, know what options you have, gives you things that you can easily do to help augment what your veterinarian is doing, um, and it helps you know how to advocate for your dog because that's you definitely want the best care for your dog, and there are ways that you can improve the chance of them getting the best care. Okay. And then one more thing, let's put this one up. Um, I actually just coordinated with a lab that will come to your home and draw your dog's blood and test for valley fever. So it does a valley fever, they do a valley fever titer, but they also do all the core tests that I recommend. Things like a complete blood count or a CBC, a chemistry panel that looks at liver and kidney function and proteins and electrolytes and glucose. It does a thyroid test. It does a heartworm test because that can look like valley fever. It does tick-borne disease testing like Ehrlichia and Lyme, which can also mimic valley fever, or you can have both of those things going on. So these are the tests that I usually run for dogs that um, that will help identify, if it's valley fever and maybe where it is in the body, if it's more places than just the lungs, or if it's not valley fever, if it could be something else similar like the tick-borne diseases. And the other thing I like to the other reason I like to do this test is because valley fever titers are very unpredictable because your dog can have a negative titer and still have valley fever, and that same thing goes for people. You can have a negative titer because the body hasn't made antibodies or the body has walled off wherever the valley fever is, and the immune system can't see it and can't make antibodies. So you can actually have a really severe infection and not have a titer, or you can have a mild infection and have a real high titer, or a horrible infection and have a low titer. Like, it's very inconsistent and the testing is not perfect. There's no perfect test for anything, but valley fever is an kind of a test that we need to do. We need to improve, and they are working on improved tests for valley fever. Um, but if you still feel like your dog has valley fever and the titer is negative, we can look at these other things like the CBC and the chemistry panel and the thyroid test. And that can give us clues that we do have valley fever and we need to either trial treat or we need to look at other tests. There are tests that you can do to try to confirm it. Sometimes when you test early in the infection, the immune system hasn't had time to make antibodies that are detected in the blood. So, so if you're interested in a test where the technicians come to your home and draw the blood and send the blood to the same lab that your vet uses, scan the QR code, and we'll get that test ordered, or I'll get the test ordered, and have the lab call you to schedule an appointment at your convenience. All right. So that's all about valley fever. I just wanted to get on here and talk more about it because I think it's confusing to pet parents, it's confusing to people, it's confusing to um, veterinarians and physicians. And the more that it's out there and we have awareness and are thinking about it when we see these cases that maybe aren't responding to what treatment they're getting. A lot of times, dogs will get antibiotics over and over and over for these infections that's not working. And so, if someone knows about the fungal infections like valley fever, they'll actually test for it. Um, so, if your dog has weird symptoms and maybe some of the symptoms that I went over, and they haven't been tested for valley fever, I would definitely test them for valley fever. Okay. All right. So have a great day, and we'll be talking more about valley fever. Okay. Thanks for watching.